Hi, I am Dr. Sunil Dwivedi, consultant cardiologist at Manipal Hospital, Millers Road. Today I'll just speak to you briefly about stress and heart disease and how to deal with them. See, stress is part of our daily life. It is part of a primitive reflex which was part of fight and flight. So stress will lead to responses in the body where stress hormones will be developed, and it will help us in fighting or fleeing whenever is the situation demands. But in the modern life, when the stress becomes more, it will create trouble for the whole body, especially for heart disease and stroke. So when there is a stress, the stress, psychological stress is perceived, and there is a hypothalamus which will give signal to the body. It will release stress hormones which are epinephrine, norepinephrine and cortisols. So they will increase the heart rate, blood pressure, and prepare the body to fight. And then when it is there prolonged, then it will cause deleterious effects such as blood pressure can increase. When the heart rate increases, the heart gets very stressed, the blood becomes more clotting tendency happens, so it leads to more heart attack or event or stroke. On top of that, it increases the blood sugars also, and if there is a prolonged effect, then it will lead to diabetes also. Then with stress, there are tendency to overeat many times, less exercise and mental dullness, which increases these further problems further. So how to deal with stress? There are few points about it. Like one is at individual level, one at society level. But at individual level, there are physical and mental aspect. Physical aspect is that you need to have learn the breathing exercises and physical activity to relax yourself, like walking or taking any hobby or sports which may not be professional. Mental is relaxation techniques of breathing, having your company of friends which are your near dear friends or your social friends which are as a group. So communicating with them, sharing your thoughts, and engaging into some hobby which is physical or mental leads to reduction of stress. But the most important thing is to recognize a constant persistent stress in the life, not intermittent stress, because that unrecognized stress is one of the major leading cause of having heart trouble or in general health trouble. Thank you.